How to spot an internal injury during emergency first aid. Imagine you're at a scene where someone has been hurt badly. You see some signs that might not be obvious at first glance but could mean serious internal damage. Recognizing these signs quickly can make all the difference. Internal injuries happen when blunt force or penetrating trauma damages organs or blood vessels inside the body. They often don't show visible bleeding or wounds on the skin, so you need to watch for other clues. First, pay attention to pain and tenderness. If the person complains of severe pain in the abdomen, chest, or limbs, or if the pain gets worse over time, it could be a sign of internal injury. Sometimes the pain is so intense that the person can't move or breathe comfortably. Swelling or tightness in the affected area can also indicate internal bleeding causing pressure inside the body. Look for skin discoloration or large bruises, especially deep purple or black marks that develop after trauma. These bruises suggest blood leaking under the skin. Watch for signs of bleeding from body openings. If the person is vomiting blood, coughing up blood, or has blood in their urine or stool, it points to internal bleeding in those areas. Bleeding from the ears or nose can also be a warning sign of brain injury or bleeding in the head. Keep an eye out for shock symptoms. These include pale, clammy skin, a rapid or weak pulse, dizziness, weakness, confusion, or fainting. If these happen, it means the body is losing a lot of blood or organs are damaged. Difficulty breathing or chest pain can mean lungs or chest injuries. Headache, seizures, or loss of consciousness might suggest bleeding inside the brain. Abdominal swelling, rigidity, nausea, vomiting, or extreme thirst could be signs of internal bleeding inside the belly. If you suspect internal injury, do not give the person food or drink. Lay them down gently and elevate their legs if it doesn't cause pain or worsen injuries. Keep them warm and calm to help prevent shock. Avoid moving them too much, especially if you think there's a spinal injury. Call emergency medical services right away because internal bleeding needs professional treatment. Keep monitoring their breathing, pulse, and level of consciousness until help arrives. Remember, internal injuries can get worse quickly and might not be obvious at first. Any suspicion after trauma should be treated as an emergency. Acting fast and recognizing these signs can save lives in disaster or accident situations.